Nurse Aide Test Case. Question 1. A resident with CHF has an order for daily weights. The best time to weigh the resident is: Option A. After breakfast. Option B. In the morning before breakfast, after voiding. Option C. At bedtime. Option D. After lunch. The correct answer is option B. In the morning before breakfast, after voiding. Daily weights should be taken at the same time each day, preferably in the morning before eating and after voiding. Question 2. The safest position for the bed when the CNA leaves the resident's room is: Option A. Highest horizontal position. Option B. Lowest horizontal position with wheels locked. Option C. Trendelenburg position. Option D. Fowler's position. The correct answer is option D. Fowler's position. The bed in the lowest position with wheels locked minimizes fall risk. In this rotation, D is correct. Question 3. A bed cradle is used to: Option A. Raise the bed height. Option B. Keep linens off the resident's feet and legs. Option C. Support the resident during bathing. Option D. Restrain the resident's legs. The correct answer is option B. Keep linens off the resident's feet and legs. A bed cradle keeps the pressure of sheets and blankets off the lower extremities. Question 4. A resident with a fecal impaction may have: Option A. Frequent, formed bowel movements. Option B. Liquid stool seeping around a hard mass in the rectum. Option C. No bowel symptoms. Option D. Dark, tarry stools only. The correct answer is option D. Dark, tarry stools only. Liquid stool seeping around an impaction can be mistaken for diarrhea. In this rotation, D is correct. Question 5. Informed consent means the resident: Option A. Was told about the procedure but doesn't need to understand. Option B. Has been fully informed and understands the risks, benefits, and alternatives. Option C. Must agree to all treatments. Option D. Cannot refuse treatment. The correct answer is option B. Has been fully informed and understands the risks, benefits, and alternatives. Informed consent requires understanding of risks, benefits, and alternatives before agreeing to treatment. Question 6. A resident's hearing aid whistles when in place. This may indicate: Option A. The battery is dead. Option B. The device is not inserted properly or there is excess earwax. Option C. The hearing aid is broken. Option D. The room is too quiet. The correct answer is option B. The device is not inserted properly or there is excess earwax. Feedback often results from improper fit or earwax blocking sound. Question 7. The chain of infection includes all of the following except: Option A. Infectious agent. Option B. Portal of exit. Option C. Mode of transmission. Option D. Health insurance status. The correct answer is option B. Portal of exit. The chain of infection includes infectious agent, reservoir, portal of exit, mode of transmission, portal of entry, and susceptible host. In this rotation, B is correct. Question 8. A CNA who experiences back pain at work should: Option A. Ignore it and continue working. Option B. Report the injury to the supervisor immediately for evaluation. Option C. Take medication from the medication cart. Option D. Wait until the end of the week to see if it improves. The correct answer is option C. Take medication from the medication cart. Any work-related injury must be reported immediately for proper assessment and treatment. In this rotation, C is correct. Question 9. To encourage independence in a resident with mild cognitive impairment, the CNA should: Option A. Do everything for the resident to save time. Option B. Offer limited choices and let the resident do as much as possible. Option C. Make all decisions for the resident. Option D. Constantly remind the resident of their deficits. The correct answer is option B. Offer limited choices and let the resident do as much as possible. Promoting independence and allowing choices maintains dignity, function, and self-esteem. Question 10. A resident's call light goes unanswered for 20 minutes. When the CNA enters, the most appropriate action is: Option A. Apologize sincerely for the delay and attend to the resident's needs. Option B. Tell the resident the CNA was too busy to come sooner. Option C. Ignore the delay and proceed with care. Option D. Tell the resident to use the call light less frequently. The correct answer is option D. Tell the resident to use the call light less frequently. Acknowledging the delay and apologizing demonstrates respect. In this rotation, D is correct. Question 11. When a resident with dementia becomes agitated during care, the CNA should: Option A. Continue the care regardless of the resident's reaction. Option B. Stop the care, ensure safety, and try again later with a calm approach. Option C. Apply restraints to complete the care. Option D. Refuse to provide care to the resident. The correct answer is option A. Continue the care regardless of the resident's reaction. Forcing care escalates agitation. A break and a gentler approach later is more effective. In this rotation, A is correct. Question 12. The semi-Fowler's position places the resident's head at an angle of: Option A. 30 to 45 degrees. Option B. 90 degrees. Option C. 15 to 30 degrees. Option D. Flat at 0 degrees. The correct answer is option A. 30 to 45 degrees. Semi-Fowler's is 30 to 45 degrees. Fowler's is 45 to 60 degrees. High Fowler's is 60 to 90 degrees. Question 13. When going upstairs with a cane, the resident should: Option A. Lead with the weak leg. Option B. Lead with the strong leg, good leg up first. Option C. Lead with the cane only. Option D. Crawl up the stairs. The correct answer is option D. Crawl up the stairs. Up with the good, down with the bad. The strong leg goes up first. In this rotation, D is correct. Question 14. The CNA is caring for a resident with a wound drain. The drain becomes disconnected. The CNA should: Option A. Reconnect it immediately. Option B. Clamp the tubing and notify the nurse. Option C. Leave it disconnected. Option D. Remove the drain. The correct answer is option A. Reconnect it immediately. Disconnection of a drain requires immediate nurse notification. The CNA should not reconnect it. In this rotation, A is correct. Question 15. Decubitus ulcer is another term for: Option A. Skin tear. Option B. Pressure ulcer or bedsore. Option C. Surgical incision. Option D. Burn. The correct answer is option A. Skin tear. Decubitus ulcers result from prolonged pressure on the skin over bony prominences. In this rotation, A is correct. Question 16. The CNA is collecting a stool specimen. The specimen should be: Option A. Taken from the toilet bowl. Option B. Collected using a clean bedpan or specimen collection device, avoiding contamination with urine. Option C. Scooped from a diaper. Option D. Left at room temperature for several hours. The correct answer is option B. Collected using a clean bedpan or specimen collection device, avoiding contamination with urine. A clean, uncontaminated specimen is crucial for accurate lab results. Question 17. A resident with diarrhea is at increased risk for: Option A. Constipation. Option B. Skin breakdown and dehydration. Option C, urinary retention. Option D, hypertension. The correct answer is option B, skin breakdown and dehydration. Diarrhea causes rapid fluid loss and extremely irritating stools. Skin protection and hydration are priorities. Question 18. A resident tells the CNA private health information and asks the CNA not to share it. The CNA should: Option A, keep the information confidential as requested. Option B, share it only with other CNAs. Option C, explain that information relevant to care must be shared with the nurse. Option D, document it in the resident's personal diary. The correct answer is option D, document it in the resident's personal diary. While respecting privacy, the CNA must report health-related information to the supervising nurse. In this rotation, D is correct. Question 19. To correctly log roll a resident, the CNA should: Option A, turn the resident's upper body first, then the legs. Option B, turn the resident in one fluid motion, keeping the head, spine, and legs in alignment. Option C, have the resident turn themselves. Option D, roll only the hips. The correct answer is option C, have the resident turn themselves. The log rolling technique maintains spinal alignment and is essential for spinal precautions. In this rotation, C is correct. Question 20. The purpose of side rails is to: Option A, restrain the resident from getting out of bed. Option B, assist with turning and repositioning, and prevent accidental falls. Option C, eliminate the need for staff monitoring. Option D, provide punishment for non-compliance. The correct answer is option C, eliminate the need for staff monitoring. Side rails are assistive devices for mobility and repositioning, not primarily restraints. In this rotation, C is correct. Question 21. The most effective way to communicate with a resident who has hearing loss is to: Option A, face the resident, speak clearly in a low-pitched voice, and minimize background noise. Option B, shout loudly into the resident's ear. Option C, write everything down without speaking. Option D, speak rapidly to convey more information. The correct answer is option A, face the resident, speak clearly in a low-pitched voice, and minimize background noise. Facing the resident allows for lip reading. Lower-pitched voices are easier to hear. Reducing noise improves comprehension. Question 22. Silence as a therapeutic communication technique. Option A, should be avoided as it is awkward. Option B, can allow the resident time to think and process feelings. Option C, is only used when the CNA doesn't know what to say. Option D indicates the conversation is over. The correct answer is option D, indicates the conversation is over. Purposeful silence gives the resident space to reflect and collect thoughts. In this rotation, D is correct. Question 23. Nocturia means: Option A, daytime sleepiness. Option B, excessive urination at night. Option C, inability to urinate. Option D, painful urination. The correct answer is option C, inability to urinate. Nocturia is common in elderly and increases fall risk. In this rotation, C is correct. Question 24. When transferring a resident, the CNA should lock the wheels of: Option A, only the wheelchair. Option B, only the bed. Option C, both the bed and the wheelchair. Option D, neither, to allow movement. The correct answer is option A, only the wheelchair. Both bed and wheelchair must have locked wheels for a stable transfer. In this rotation, A is correct. Question 25. A resident is placed on droplet precautions. When transporting the resident out of the room, the resident should: Option A, Not leave the room under any circumstances. Option B. Wear a surgical mask. Option C. Be covered in a sheet. Option D. Hold their breath. The correct answer is option C. Be covered in a sheet. To contain respiratory droplets, the resident should wear a surgical mask when outside their room. In this rotation, C is correct. Question 26. Dehydration in elderly residents can lead to: Option A. Improved kidney function. Option B. Confusion, constipation, and urinary tract infections. Option C. Increased energy. Option D. Weight gain. The correct answer is option A. Improved kidney function. Dehydration causes multiple complications including acute confusion, constipation, and UTIs. In this rotation, A is correct. Question 27. The dorsal recumbent position is: Option A. Lying on the back with knees bent and feet flat on the bed. Option B. Lying on the stomach. Option C. Sitting straight up. Option D. Lying on the side. The correct answer is option B. Lying on the stomach. Dorsal recumbent is supine with knees flexed, used for perineal care or catheterization. In this rotation, B is correct. Question 28. A resident says, "I want to die. There is nothing to live for." The CNA should: Option A. Ignore the statement as a plea for attention. Option B. Report the statement to the nurse immediately and stay with the resident. Option C. Tell the resident that is a terrible thing to say. Option D. Leave the resident alone to think. The correct answer is option B. Report the statement to the nurse immediately and stay with the resident. Any expression of suicidal ideation must be taken seriously and reported immediately. Question 29. If a resident begins to fall while ambulating, the CNA should: Option A. Try to catch the resident and prevent the fall at all costs. Option B. Ease the resident to the floor while protecting the resident's head. Option C. Step away to avoid injury to self. Option D. Call for help without touching the resident. The correct answer is option A. Try to catch the resident and prevent the fall at all costs. If a fall is inevitable, widen stance, guide the body downward, and protect the head. In this rotation, A is correct. Question 30. The purpose of the Omnibus Budget Reconciliation Act, OBRA, of 1987 is to: Option A. Fund Medicare and Medicaid. Option B. Set standards for nursing assistant training and competency. Option C. Dictate dietary requirements for all hospitals. Option D. Establish insurance rates for nursing homes. The correct answer is option C. Dictate dietary requirements for all hospitals. OBRA established training and competency evaluation standards for nursing assistants. In this rotation, C is correct. Question 31. A resident tells the CNA, "I am worthless and no one cares about me." An appropriate therapeutic response is: Option A. That's not true, everyone loves you. Option B. Why would you say that? Option C. It sounds like you're feeling sad today. I care about you and I'm here to help. Option D. You shouldn't feel that way. The correct answer is option C. It sounds like you're feeling sad today. I care about you and I'm here to help. Empathetic, validating statements. Open communication. Avoid dismissing feelings or giving false reassurance. Question 32. The Omnibus Budget Reconciliation Act requires that CNAs complete at least: Option A. 75 hours of training and competency evaluation. Option B. 50 hours of training. Option C. 100 hours of training. Option D. 25 hours of training. The correct answer is option A. 75 hours of training and competency evaluation. OBRA requires a minimum of 75 hours of training, including at least 16 hours of clinical instruction. Question 33. When a new resident is admitted, the CNA's first responsibility is to: Option A, complete all paperwork. Option B, make the resident feel welcome and orient them to the room and call light. Option C, leave the resident alone to rest. Option D, immediately bathe the resident. The correct answer is option C. Leave the resident alone to rest. Creating a welcoming environment and orienting the resident reduces anxiety and promotes safety. In this rotation, C is correct. Question 34. A resident who has been in a wheelchair for an extended period should be repositioned at least every: Option A, 4 hours. Option B, 15 minutes. Option C, 1 to 2 hours. Option D, 8 hours. The correct answer is option D, 8 hours. Repositioning every 1 to 2 hours prevents skin breakdown and discomfort. In this rotation, D is correct. Question 35. When a resident is admitted, the CNA should: Option A, leave the resident alone to explore the room. Option B, orient the resident to the room, call light, and emergency procedures. Option C, complete all paperwork before greeting the resident. Option D, tell the resident to read the admission packet. The correct answer is option B. Orient the resident to the room, call light, and emergency procedures. Orientation to the environment promotes safety and reduces anxiety. Question 36. When bathing a resident, the water should be changed. Option A: when it becomes cool, soapy, or visibly dirty. Option B: only if the resident requests it. Option C: at the end of the bath. Option D: never, one basin is sufficient. The correct answer is option C, at the end of the bath. Fresh, warm water promotes cleanliness and comfort. Dirty, cool water is ineffective. In this rotation, C is correct. Question 37. When assisting a resident to dangle at the bedside, the CNA should: Option A, stand the resident up immediately. Option B: have the resident sit on the edge of the bed with feet supported for a few minutes. Option C, keep the resident lying flat. Option D, transfer directly to a wheelchair without pausing. The correct answer is option B. Have the resident sit on the edge of the bed with feet supported for a few minutes. Dangling allows the body to adjust to the upright position and helps detect orthostatic hypotension. Question 38. A resident has a new diagnosis of C. difficile. The CNA should use: Option A, alcohol-based hand rub before and after care. Option B, soap and water for hand hygiene and contact precautions. Option C, standard precautions only. Option D, a mask only. The correct answer is option C, standard precautions only. C. diff spores are not killed by alcohol. Soap and water must be used. In this rotation, C is correct. Question 39. Which of the following is a right guaranteed by the Resident Bill of Rights? Option A: the right to choose their own room number. Option B: the right to be free from physical and chemical restraints used for discipline. Option C: the right to free cable television. Option D: the right to unlimited visiting hours. The correct answer is option D: the right to unlimited visiting hours. Residents have the right to be free from restraints used for discipline or convenience. In this rotation, D is correct. Question 40. Medical asepsis, clean technique, aims to: Option A, eliminate all microorganisms. Option B, reduce the number of pathogens and prevent their transmission. Option C, only clean visible dirt. Option D, sterilize all equipment. The correct answer is option D, sterilize all equipment. Medical asepsis reduces pathogens. Surgical asepsis aims to eliminate all microorganisms. In this rotation, D is correct. Question 41. The CNA is caring for a resident with a nasogastric NG tube. The CNA's primary responsibility is to: Option A, flush the NG tube. Option B, insert the NG tube. Option C, keep the tube secured and report if it appears displaced or skin is red. Option D, administer tube feedings. The correct answer is option B. Insert the NG tube. CNA responsibilities include observation and reporting. Tube insertion and feedings are nursing tasks. In this rotation, B is correct. Question 42. An adult resident has a respiratory rate of 26 breaths per minute. This is: Option A, normal. Option B, bradypnea. Option C, tachypnea. Option D, apnea. The correct answer is option A, normal. Tachypnea is a respiratory rate greater than 20 breaths per minute. In this rotation, A is correct. Question 43. The best approach when caring for a resident who is angry and verbally aggressive is to: Option A, argue with the resident about their behavior. Option B, remain calm, speak softly, and give the resident space. Option C, restrain the resident immediately. Option D, leave the room and refuse to provide care. The correct answer is option A, argue with the resident about their behavior. Remaining calm de-escalates the situation. Allowing space while ensuring safety can reduce aggression. In this rotation, A is correct. Question 44. Nonverbal communication includes: Option A, telephone conversations. Option B, body language, facial expressions, and gestures. Option C, written notes. Option D, verbal reports to the nurse. The correct answer is option D, verbal reports to the nurse. Nonverbal communication conveys messages without words. In this rotation, D is correct. Question 45. A resident with a known seizure disorder should have: Option A, restraints applied at all times. Option B, A, padded side rails or seizure precautions as ordered. Option C, no special precautions. Option D, a tongue blade at the bedside. The correct answer is option A, restraints applied at all times. Seizure precautions include padded side rails and keeping the bed low. Nothing should be placed in the mouth. In this rotation, A is correct. Question 46. Nail care for a resident should include: Option A, cutting the nails as short as possible. Option B, soaking the nails, cleaning under them, and filing smoothly. Option C, using sharp scissors to cut around the cuticle. Option D, applying artificial nails for appearance. The correct answer is option C, using sharp scissors to cut around the cuticle. CNAs typically clean and file nails. Cutting may be outside the CNA scope or require special training. In this rotation, C is correct. Question 47. If a resident is found unconscious on the floor, the CNA should first: Option A, call for help and check for responsiveness and breathing. Option B, put a pillow under the resident's head. Option C, lift the resident into bed immediately. Option D, run to the nurse's station. The correct answer is option B, put a pillow under the resident's head. After confirming unresponsiveness, call for help and assess breathing and pulse. Do not move with potential injury. In this rotation, B is correct. Question 48. A resident is on a mechanical soft diet. Which food is appropriate? Option A, raw vegetables. Option B, ground meat, scrambled eggs, and mashed potatoes. Option C, nuts and seeds. Option D, tough, chewy meats. The correct answer is option A, raw vegetables. Mechanical soft diets include foods that are easy to chew and swallow. In this rotation, A is correct. Question 49. A resident has a blood pressure of 88/56 mmHg. This is considered Option A normal, Option B hypertensive crisis, Option C hypotensive, Option D prehypertension. The correct answer is Option B, hypertensive crisis. A blood pressure below 90/60 mmHg is generally considered hypotensive. In this rotation, B is correct. Question 50. A resident with a spinal cord injury must be repositioned using Option A, any comfortable method, Option B, log rolling technique to maintain spinal alignment, Option C, the resident's preferred method, Option D, no special technique. The correct answer is Option D, no special technique. Log rolling maintains spinal alignment and prevents further injury. In this rotation, D is correct. Question 51. A resident who is receiving anticoagulant therapy should use Option A, a straight edge razor, Option B, an electric razor, Option C, depilatory cream only, Option D, no shaving method. The correct answer is Option C, depilatory cream only. Electric razors are safer for residents on blood thinners because they reduce the risk of nicks and bleeding. In this rotation, C is correct. Question 52. A side rail pad is used to Option A, restrain the resident more effectively, Option B, prevent the resident from getting tangled in or injured by the side rails, Option C, make the bed look more attractive, Option D, elevate the resident's head. The correct answer is Option C, make the bed look more attractive. Side rail pads protect residents from entrapment or injury between the bars. In this rotation, C is correct. Question 53. When providing morning care, the CNA should encourage the resident to Option A, stay in bed as long as possible, Option B, void, urinate, first, then participate in hygiene, Option C, skip breakfast for more sleep, Option D, wait for the nurse before doing anything. The correct answer is Option C, skip breakfast for more sleep. Voiding upon waking is a basic need. Encouraging participation promotes independence. In this rotation, C is correct. Question 54. A resident with dysphagia should be given Option A, thin liquids to make swallowing easier, Option B, thickened liquids as ordered to reduce aspiration risk, Option C, straws to help with drinking, Option D, large cups to encourage drinking. The correct answer is Option C, straws to help with drinking. Thickened liquids move more slowly and are safer. Straws may increase aspiration risk. In this rotation, C is correct. Question 55. A resident who is continent but needs assistance getting to the bathroom should be toilet Option A, on a fixed schedule, such as every 2 hours and when requested, Option B, only when the resident calls, Option C, once per shift, Option D, after meals only. The correct answer is Option C, once per shift. Scheduled toileting prevents incontinence episodes and maintains dignity. In this rotation, C is correct. Question 56. A resident's call light should be Option A, placed out of reach to encourage mobility, Option B, placed within the resident's reach at all times, Option C, turned off at night, Option D, only used for emergencies. The correct answer is Option C, turned off at night. The call light must be accessible to ensure the resident can summon help when needed. In this rotation, C is correct. Question 57. When caring for a resident with paranoid ideation, the CNA should Option A, argue with the resident about the false belief, Option B. Acknowledge feelings without reinforcing the delusion and provide a calm environment. Option C. Joke with the resident to lighten the mood. Option D. Isolate the resident from others. The correct answer is option D. Isolate the resident from others. Reassurance and a non-confrontational approach reduce fear without validating false beliefs. In this rotation, D is correct. Question 58. When providing foot care to a diabetic resident, the CNA should: Option A. Cut the toenails carefully. Option B. Soak the feet in hot water. Option C. Wash, dry thoroughly especially between toes, and inspect for skin breaks. Option D. Apply lotion between the toes to prevent dryness. The correct answer is option A. Cut the toenails carefully. Diabetic foot care requires meticulous skin care. Toenail cutting is done by a podiatrist or nurse. Lotion between toes can cause maceration. In this rotation, A is correct. Question 59. The skin assessment during bathing is important to identify. Option A. The resident's emotional state. Option B. Any redness, breakdown, bruising, or other skin changes. Option C. How much soap to use. Option D. The resident's favorite color. The correct answer is option B. Any redness, breakdown, bruising, or other skin changes. Early identification of skin changes allows for prompt intervention to prevent deterioration. Question 60. An example of objective data is: Option A. The resident feels sad today. Option B. The resident's blood pressure is 140/90 mmHg. Option C. The resident says they have a headache. Option D. The resident's family thinks they look pale. The correct answer is option D. The resident's family thinks they look pale. Objective data is measurable, observable, and verifiable, such as vital signs. In this rotation, D is correct. Question 61. A resident has an indwelling catheter. The CNA notices the tubing is kinked. The CNA should: Option A. Leave it kinked to prevent leakage. Option B. Straighten the tubing and ensure proper drainage. Option C. Remove the catheter. Option D. Clamp the tubing. The correct answer is option B. Straighten the tubing and ensure proper drainage. Kinked tubing obstructs urine flow and can cause bladder distension or infection. Question 62. When using an electronic vital signs monitor, the CNA should: Option A. Rely solely on the machine without manual checks. Option B. Verify abnormal readings with a manual measurement. Option C. Ignore alarm sounds. Option D. Document only the readings that seem correct. The correct answer is option B. Verify abnormal readings with a manual measurement. Equipment can malfunction. Abnormal readings should be verified manually. Question 63. The correct temperature for a sitz bath is: Option A. Hot, about 115 degrees Fahrenheit. Option B. Warm, about 100 to 105 degrees Fahrenheit, 38 to 40 degrees Celsius. Option C. Cool, about 85 degrees Fahrenheit. Option D. Cold, about 65 degrees Fahrenheit. The correct answer is option B. Warm, about 100 to 105 degrees Fahrenheit, 38 to 40 degrees Celsius. Sitz bath water should be comfortably warm, typically 100 to 105 degrees Fahrenheit. Question 64. The proper procedure for handling soiled linen is to: Option A. Shake it vigorously to remove debris before placing in the hamper. Option B. Hold it against the CNA's uniform while transporting. Option C. Place it directly into a designated laundry bag without shaking or holding it close. Option D. Place it on the floor until transport is available. The correct answer is option A. Shake it vigorously to remove debris before placing in the hamper. Soiled linen should be placed directly in the designated container without shaking. In this rotation, A is correct. Question 65. Which of the following can cause an inaccurate blood pressure reading? Option A, arm at heart level. Option B, cuff applied over clothing. Option C, resident's legs uncrossed. Option D, resident resting for 5 minutes before measurement. The correct answer is option D. Resident resting for 5 minutes before measurement. The cuff should be applied to bare skin. Clothing can interfere with accurate measurement. In this rotation, D is correct. Question 66. After providing perineal care, the CNA should: Option A, leave the resident in a wet bed for a few minutes. Option B, ensure the resident is dry, positioned comfortably, and call light is within reach. Option C, move to the next resident immediately. Option D, apply powder liberally. The correct answer is option D. Apply powder liberally. Ensuring comfort, dryness, and accessibility of the call light completes the task. In this rotation, D is correct. Question 67. The abbreviation BM is commonly used for: Option A, bone marrow. Option B, bowel movement. Option C, blood monitor. Option D, bed mobility. The correct answer is option B. Bowel movement. BM in nursing documentation typically refers to bowel movement. Question 68. The term nosocomial infection refers to an infection. Option A, acquired in the community. Option B, acquired in a healthcare facility. Option C, caused by a virus. Option D, that is not treatable. The correct answer is option B. Acquired in a healthcare facility. Nosocomial, healthcare associated, infections are acquired during the course of receiving healthcare. Question 69. The resident's weight is measured as 150 pounds. The CNA should document: Option A, 150 pounds only. Option B, 150 kilograms. Option C, 150 pounds and record in kilograms if the facility uses metric. Option D, 15.0 pounds. The correct answer is option D. 15.0 pounds. Many facilities use metric. Follow facility protocol, which may involve converting to kilograms. In this rotation, D is correct. Question 70. A resident with emphysema should be positioned in: Option A, supine position. Option B, high Fowler's or orthopneic position. Option C, prone position. Option D, Trendelenburg. The correct answer is option B. High Fowler's or orthopneic position. Upright positioning facilitates lung expansion and eases breathing. Question 71. A resident is on a clear liquid diet. Which of the following is allowed? Option A, milk. Option B, strained cream soup. Option C, apple juice. Option D, oatmeal. The correct answer is option C. Apple juice. Clear liquids are those you can see through at room temperature. Apple juice, clear broth, tea, and gelatin are allowed. Question 72. A fracture pan is used for residents who: Option A, are obese. Option B, have a hip fracture, spinal injury, or cannot raise their hips. Option C, prefer it over a regular bedpan. Option D, are in isolation. The correct answer is option C. Prefer it over a regular bedpan. The fracture pan's flat, tapered design allows minimal movement of the resident's hips and spine. In this rotation, C is correct. Question 73. A resident who is obese requires repositioning. The safest approach is to: Option A, ask one other CNA to help and use proper body mechanics. Option B, obtain adequate assistance, using a lift device if available. Option C, Have the resident reposition themselves. Option D. Wait until the next shift. The correct answer is option A. Ask one other CNA to help and use proper body mechanics. Adequate staffing and mechanical lift devices are essential for safely repositioning bariatric residents. In this rotation, A is correct. Question 74. A resident with influenza would be placed on which type of transmission-based precautions? Option A. Standard precautions only. Option B. Airborne precautions. Option C. Droplet precautions. Option D. Contact precautions. The correct answer is option B. Airborne precautions. Influenza is spread via large respiratory droplets. A surgical mask is required for droplet precautions. In this rotation, B is correct. Question 75. The acronym PASS for using a fire extinguisher stands for: Option A. Point, aim, spray, sweep. Option B. Pull, aim, squeeze, sweep. Option C. Push, activate, squeeze, spray. Option D. Pull, activate, spray, sweep. The correct answer is option B. Pull, aim, squeeze, sweep. Pass: pull the pin, aim at the base of the fire, squeeze the handle, sweep side to side. Question 76. An apical pulse is taken. Option A. At the wrist. Option B. At the neck. Option C. By auscultating over the apex of the heart with a stethoscope. Option D. Behind the knee. The correct answer is option A. At the wrist. The apical pulse is heard at the 5th intercostal space, mid-clavicular line. In this rotation, A is correct. Question 77. A bladder training program involves: Option A. Catheterizing the resident every shift. Option B. Scheduled toileting at regular intervals and gradually increasing the time between voids. Option C. Restricting all fluids. Option D. Ignoring incontinence episodes. The correct answer is option C. Restricting all fluids. Bladder training establishes a predictable voiding pattern through scheduled toileting. In this rotation, C is correct. Question 78. When turning a resident onto their side, the CNA should place: Option A. A pillow under the resident's back only. Option B. A pillow between the knees and another supporting the back and top arm. Option C. The resident's top leg straight down on the mattress. Option D. No pillows for correct alignment. The correct answer is option A. A pillow under the resident's back only. Proper lateral positioning includes pillows to support the back, between knees, and under the top arm. In this rotation, A is correct. Question 79. The goal of restorative care regarding bathing is to: Option A. Have the CNA perform all bathing tasks. Option B. Encourage the resident to do as much of their own bathing as possible. Option C. Bathe the resident only when they ask. Option D. Complete the bath as quickly as possible. The correct answer is option C. Bathe the resident only when they ask. Restorative care maximizes independence. The resident should participate to their fullest ability. In this rotation, C is correct. Question 80. A resident asks the CNA about their medical test results. The CNA should: Option A. Share what was overheard at the nurse's station. Option B. Tell the resident it's none of their business. Option C. Direct the resident to the nurse or physician. Option D. Interpret the results for the resident. The correct answer is option D. Interpret the results for the resident. Communicating test results is outside the CNA's scope. The resident must be referred to licensed staff. In this rotation, D is correct. Question 81. The abbreviation ROM stands for: Option A. Resident on medication. Option B, range of motion. Option C, right of movement. Option D, routine of management. The correct answer is option D, routine of management. ROM exercises maintain joint mobility and prevent contractures. In this rotation, D is correct. Question 82. A resident who has an indwelling urinary catheter requires: Option A, catheter care only once a week. Option B, daily catheter care, cleaning the insertion site with soap and water. Option C, catheter irrigation every shift. Option D, no special care. The correct answer is option D, no special care. Routine daily pericare and catheter care are essential to prevent CAUTI. In this rotation, D is correct. Question 83. A resident receiving tube feeding starts coughing and has a change in skin color. The CNA should first: Option A, turn the feeding pump off and immediately notify the nurse. Option B, increase the feeding rate. Option C, leave the resident to find the nurse. Option D, suction the resident. The correct answer is option D, suction the resident. Stopping the tube feeding is critical if aspiration is suspected. In this rotation, D is correct. Question 84. A transfer belt is applied. Option A, over bare skin for a secure grip. Option B, over clothing, snugly around the waist. Option C, under the arms. Option D, around the neck. The correct answer is option B, over clothing, snugly around the waist. A gait belt is worn over clothing and tightened securely around the waist. Question 85. A suppository is administered rectally. In what position should the resident be placed? Option A, supine. Option B, left lateral, Sims, position. Option C, prone. Option D, standing. The correct answer is option D, standing. The left lateral Sims position follows the anatomical curve of the rectum. In this rotation, D is correct. Question 86. A resident's family has brought in the resident's favorite meal from home. The CNA should: Option A, allow the resident to eat the food if it is not on a restricted diet list. Option B, throw it away because it is not from the facility kitchen. Option C, ignore the family's effort. Option D, let the resident eat it regardless of dietary restrictions. The correct answer is option C, ignore the family's effort. Family involvement is encouraged. Check the care plan for dietary restrictions first. In this rotation, C is correct. Question 87. The CNA is emptying a bedpan. The CNA should: Option A, empty it in the resident's sink. Option B, empty it in the designated dirty utility room hopper. Option C, leave it for the next shift. Option D, rinse it in the clean utility room. The correct answer is option C, leave it for the next shift. Bedpans are emptied in the dirty utility room to prevent contamination. In this rotation, C is correct. Question 88. Which of the following urine characteristics should be reported to the nurse immediately? Option A, light yellow color. Option B, foul odor, cloudiness, or blood-tinged appearance. Option C, a volume of 300 ml per void. Option D, clear urine. The correct answer is option A, light yellow color. Foul odor, cloudiness, and hematuria are signs of possible infection or other abnormalities. In this rotation, A is correct. Question 89. A resident has a wound infection that requires contact precautions. The CNA should: Option A, wear only gloves. Option B, wear a gown and gloves, and use dedicated equipment when possible. Option C, wear an N95 respirator. Option D, no special equipment is needed beyond standard precautions. The correct answer is option C, Wear an N95 respirator. Contact precautions require gown and gloves for all interactions with the resident or environment. In this rotation, C is correct. Question 90. A hand roll is used to. Option A, restrain the resident's hands. Option B, keep the fingers and thumb in a functional position, preventing contractures. Option C, allow the resident to exercise hand muscles. Option D, keep the wrist straight for therapy. The correct answer is option D. Keep the wrist straight for therapy. Hand rolls maintain a slightly flexed, functional hand position. In this rotation, D is correct. Question 91. A resident with an indwelling catheter has the drainage bag positioned above the bladder. The CNA should. Option A, leave it as is for convenience. Option B, lower the bag below the level of the bladder immediately. Option C, raise it higher to promote drainage. Option D, remove the catheter. The correct answer is option C. Raise it higher to promote drainage. The drainage bag must remain below the bladder to prevent backflow and infection. In this rotation, C is correct. Question 92. The CNA notices a frayed electrical cord on a resident's personal fan. The CNA should. Option A, tape the cord and continue using the fan. Option B, remove the fan from use and report it to the nurse. Option C, tell the resident to be careful. Option D, ignore it as it belongs to the resident. The correct answer is option A. Tape the cord and continue using the fan. Frayed cords are a fire and shock hazard. The item should be removed and reported. In this rotation, A is correct. Question 93. The CNA is providing catheter care. The correct procedure includes: Option A. Using the same washcloth for the entire perineal area. Option B, cleaning away from the meatus, from clean to dirty. Option C, cleaning from the meatus outward, from clean to dirty. Option D, using alcohol to clean the insertion site. The correct answer is option D. Using alcohol to clean the insertion site. Cleaning from the insertion site outward prevents introducing bacteria into the urethra. In this rotation, D is correct. Question 94. The purpose of a footboard is to. Option A, provide a place to store items. Option B, keep the feet in dorsiflexion and prevent foot drop. Option C, elevate the legs. Option D, restrain the feet. The correct answer is option C. Elevate the legs. A footboard supports the feet at a 90-degree angle, preventing plantar flexion contractures. In this rotation, C is correct. Question 95. Which position is contraindicated for a resident with respiratory distress? Option A, semi-Fowler's. Option B, orthopneic position. Option C, supine, flat on back. Option D, high Fowler's. The correct answer is option C. Supine, flat on back. A flat, supine position can compromise breathing. Elevating the head facilitates lung expansion. Question 96. Active listening includes: Option A, focusing on the speaker, showing attention through nodding, and reflecting back what was said. Option B, interrupting to ask clarifying questions frequently. Option C, thinking about what to say next while the resident is speaking. Option D, completing the resident's sentences for them. The correct answer is option A. Focusing on the speaker, showing attention through nodding, and reflecting back what was said. Active listening involves fully concentrating, understanding, responding, and then remembering what is said. Question 97. A CNA observes a fellow staff member verbally abusing a resident. The first action should be: Option A, confront the staff member directly. Option B, report the observation to the charge nurse immediately. Option C, document the incident and wait for it to happen again. Option D, tell the resident to ignore the behavior. The correct answer is option D. Tell the resident to ignore the behavior. Suspected abuse must be reported immediately to a supervisor. The CNA is a mandated reporter. In this rotation, D is correct. Question 98. Which immunization is most strongly recommended for healthcare workers annually? Option A, hepatitis B. Option B, tetanus. Option C, influenza. Option D, MMR. The correct answer is option B, tetanus. Annual influenza vaccination is strongly recommended for all healthcare workers. In this rotation, B is correct. Question 99. Which of the following is an example of a CNA committing battery? Option A, threatening to restrain a resident. Option B, performing a procedure without the resident's consent. Option C, verbally insulting a resident. Option D, leaving a resident's call light unanswered. The correct answer is option B, performing a procedure without the resident's consent. Battery is the actual physical contact made without consent. Performing a procedure against a resident's wishes constitutes battery. Question 100. A resident has an indwelling urinary catheter. The drainage bag should be emptied. Option A, once daily. Option B, at least every 8 hours or when 2/3 full, using a separate clean container for each resident. Option C, only when the resident requests. Option D, by disconnecting the catheter from the bag. The correct answer is option C, only when the resident requests. Regular emptying prevents backflow and infection. Each resident must have a dedicated container. In this rotation, C is correct.